In 3, 2, 1. Hey, good evening, everybody. My name is Dr. Nathan Thompson with The Wellness Way Yorkville. Happy Monday evening, guys. Hope you had a great weekend. I'm going to talk about something controversial. As you know, if you followed us over the last 3 years, I definitely don't shy away from things that I believe are controversial, because I think there needs to be a discussion in regards to that. And I think that when we have a discussion, a cordial discussion, a respected discussion, I think that helps us move the needle forward, especially when it comes to healthcare. So tonight is not any more controversial, because I'm going to talk about what the FDA just approved about a week and a half ago, which is approving over-the-counter birth control. So I'm going to go over with you. And I'll talk to you about my thoughts and my opinions in regards to that. And I'll also talk about progesterone and elevations of progesterone, especially with birth control, and some of the health implications that can have over the long term. Okay, so join me for something that will be probably a little bit controversial, especially. So let's have a respectable debate and discussion in regards to that. Before we go over that, and we wait for some people to actually start jumping online. Coming up, if you are from the Chicagoland area, Thursday, August 10th, 6 o'clock p.m. is our in-person inflammation. We just had one last Thursday, had a ton of people there. It was really, really awesome. I love doing in-person events. And so if you're from the Chicagoland area, you want to work with the Wellness Way Yorkville and myself, and with Dr. Brian, make sure that you register. Go to the top of the page to our link tree, and you'll see the events page on Eventbrite, and you can register for that in-person event. We're going to talk about inflammation, guys. That's why you have to start with everything, because I asked people, is inflammation good or bad? Everybody says it's bad. And I said, you think that acute inflammation is bad, and in fact, you actually need acute inflammation. If you understand acute inflammation and what the immune system is doing, we think it's bad and it's actually good, which is why we try to suppress it so much with fever reduces pain medication, ice, and all those other things. But when inflammation can become bad is when you keep injuring it and never give the immune system a chance to completely resolve things and completely be able to heal. So when we talk about issues with weight loss resistance, you talk about cancer in the immune system and inflammation. When you talk about hormone issues and infertility, you talk about thyroid issues, arthritis, type 2 diabetes, autoimmunity, issues with your hormones. It's all first and foremost related to inflammation. There's also a huge stress component too when you talk about that as well. And so if you are from the contiguous 48 states too, and you say, hey, I want to work with you, Dr. Thompson, I need a different perspective, you can also go to our Linktree profile up at the top of the page, and you can actually watch the inflammation event as a webinar online. I believe now we have it set to every Tuesday, I think at either 6 p.m. or 7 p.m. Central Standard Time. But if you have an hour and you can watch it on demand. But it just so happens that you can't fast forward or rewind. But if you watch it all the way to the end, there'll be a link to actually schedule a initial consult with me, known as a discovery call, and then we can move forward from there. So if you are from the contiguous 48 states, then make sure that you watch that, especially if you want to work with me remotely as well. Here's our exciting announcement, guys, is Dr. Patrick Flynn, who is started the Wellness Way and best-selling author of the I Disagree book. A lot of you know that he, for a long time, he did the Hormone Connection seminars. We've had it, I think, twice in the Yorkville area. Wild success, tons of people who came to it. Well, Dr. Patrick is going to be back in the Chicagoland area, specifically in Yorkville, coming up October 24th from 6 o'clock to 9 o'clock p.m. So this is actually an in-person event. We just booked the venue. It's going to be awesome, guys. If you don't watch Dr. Patrick's A Different Perspective on Saturday morning at 8 o'clock Central Standard Time, it is one of the most watched natural health shows in the entire country. So if you've known Dr. Patrick on his shows, he's had RFK Jr., he has had Del Bigtree, he has had Peter McCullough. He's had Robert Malone. He has had some of the big movers and shakers in healthcare today. He's going to be coming to speak at the Yorkville area Tuesday, October 24th, 6 to 9 p.m. We don't have the link to register, but that will be available very shortly within the next probably 2 weeks. And we want this event to be absolutely huge, awesome, and amazing. And I have the utmost confidence that it will. So this is not going to be me speaking for once. It's going to be Dr. Patrick. And in my opinion, he's a much better speaker than I am as too. So let's talk about over-the-counter birth control that the FDA actually just approved so that you can get your birth control pills, from Walgreens or CVS or Walmart, and just be able to take it like it's candy. No different than if you were taking, Advil, Aleve, or Tums or something like that. I want to preface this, though, is that this is a discussion on health, okay? It's a discussion on health because I have seen, because I posted an opinion about that, and it quickly turned into a women's rights political issue. And let's just not talk about that, okay? Let's talk about it from a health perspective because, honestly, as a doctor in any healing profession, the number one thing should be to do no harm. Okay, so we're not going to turn it into some kind of political debate, especially because if you're watching on YouTube or Rumble, if you're watching on Facebook, you'll see what this devolved into very quickly because we had someone a comment. This was actually on TikTok, and she had said, "I'd rather be sick than pregnant." Okay. Maybe help get our rights back, and being on birth control wouldn't be an issue. Okay. And what's interesting is one of the things that I've realized is that even for many women, or they'll also say, don't tell me what to do because I'm a woman and you're a man. It doesn't make what I'm going to talk about any less true. Okay. That would be like me going and asking a woman, hey, can you give me some tips on my jump shot? And or women saying, I can help you with your jump shot. I said, you know what, you're a woman, and no, I don't want that. It can be just as sexist on the other way around as well. But also said, you also see how 19 states are trying to get our medical records. And honestly, when you talk about overreach, actually all 50 states try to get your medical records. And how they do that is they ask you for your vaccine records when you're trying to get a kid into public school. Isn't that interesting how that's okay, but when it comes to this, that's not okay? So let's not devolve into fallacies of argument, which there's many here, and let's just have a reasonable discussion when you are talking about birth control. But just as an add-on, for those who want to argue, the actual guy who co-developed birth control, Gregory Pincus, that was a man. He actually, two men developed birth control, but I don't see anybody having any problems with that. And then actually one of the largest proponents of birth control was Margaret Sanger, who was a known eugenicist who believed in superiority of races and who actually promoted birth control so that it would ultimately lead to less desirable people. That was actually one of the motivations of birth control, to have people of less intellectual capacity and less socioeconomic capacity and less intelligence to not procreate. And that's just one of the tragedies about that. But when we defend people like this, that's the sad thing. And if you really do understand the background behind it, maybe people wouldn't be arguing for it so much. So let's go back into now, so that we have actually just cleared that off the table. Let's talk about what the FDA just approved. This actually comes from the Food and Drug Administration. Okay. So on July 13, 2023, not even 2 weeks ago, the FDA approved what's known as Opill as a non-prescription oral birth control pill. Opill contains the hormone norestrogel and belongs to the class of medications, and this is what we're going to talk about, known as progestins, which are synthetic progesterone. Oat pill does not contain estrogen. And even if you look at birth control, you see that some do contain estrogen and progesterone, and some are progesterone or progestin only. And the one that they're going to be doing over the counter is progestin only. So let's go back and let's look at and have a conversation about hormones, okay? Because for many women, even if I said, tell me, draw out your hormones. I want you to draw out when you have elevations of luteinizing hormone, follicle stimulating hormone, when you have your elevations of progesterone, you have your elevations of estradiol, you have elevations of testosterone. And in fact, once you actually understand that, you'll even be able to understand why you feel certain ways at different times of the month. And you'll also be able to understand, man, if my menstrual cycle's off, then it's probably this hormone. And now understand, why is it this hormone? I'm going to show you that at the end. So let's go to Cleveland Clinic, which is a respected medical organization. Cleveland Clinic talks about progesterone. Here's what they say. What is progesterone? Progesterone is a hormone that plays an important role in your reproductive system. Progesterone supports menstruation and helps maintain the early stages of pregnancy. So progesterone maintains the endometrial lining after you ovulate. So in the second 2 weeks after you ovulate, so the second 2 weeks of your menstrual cycle. What's the main purpose of progesterone? Well, the main purpose of progesterone is to prepare the endometrial lining for a fertilized egg to implant and grow. If a pregnancy doesn't occur, the endometrium sheds during your menstrual period. If conception occurs, progesterone increases in order to support the pregnancy. Now, what causes this elevation of progesterone during this time? Well, it's known as the corpus luteum. The corpus luteum forms from the empty egg follicle after you ovulate and begins producing progesterone. How many people knew that it's coming from the corpus luteum? And in fact, even when I ask women, if you are having a menstrual cycle, if you are, of the fertile age, even asking women, where's most of your testosterone coming from? A lot of them don't even know that. Where most of your testosterone is coming from is actually coming from ovulation. It's actually coming from the ovaries, which is interesting. So your corpus luteum is a temporary gland that helps to support the beginning of a pregnancy if conception occurs during that cycle. Now, if an egg isn't fertilized during that cycle, meaning you don't get pregnant, the corpus luteum begins breaking down and decreases progesterone. And when you decrease your progesterone levels, that means it can't maintain the uterine lining. It begins breaking down, and then you start shedding that endometrial lining. And this should happen every 27, 28, 29 days, roughly within that time frame. So what does progesterone do during pregnancy? And this is important to know because of why someone would want to take progesterone in a form of birth control. Progesterone is critical in supporting a pregnancy because it thickens your uterine lining, which gives it an ability of the baby to be able to grow within the uteral lining. Progesterone levels continue to rise during pregnancy. High progesterone levels prevent your body from ovulating. Hint, hint, high progesterone levels prevent you from ovulating while you are pregnant. Because progesterone is so important in order to maintain the early stages of pregnancy, low progesterone levels make it harder for you to conceive and also may put you at a higher risk for miscarriage. This is very, very important because one of the biggest reasons for miscarriage is actually low progesterone going from the first trimester into the second trimester. So there's progesterone issues that can take place. And the other thing that can take place is a highly inflammatory condition within the uterus, which is why sometimes they will measure certain types of white blood cells known as natural killer cells, because it means that there is a very highly inflammatory state within the uterus. Interesting enough, if you look at other forms of birth control, like a copper IUD, that's its way that it works, is that it creates an inflammatory response around the endometrial lining, which then actually can cause an increase in natural killer cells, which make it a terrible, terrible environment to be able to, for an egg to be able to be conceived and then to be able to implant on the endometrial lining. So that's when they have the idea of birth control, is if we can elevate your progesterone levels, the body basically, if the progesterone levels are high enough, then the body will actually think it's in a pregnant state. Now, here's what's also really important too, guys, is how does progesterone work with estrogen? Or actually, I should say estradiol. How does it work with estrogen? This is very important. Progesterone and estrogen, or I should say estradiol, because you have 10 different estrogens, are like hormonal teammates in your body. They work together to regulate certain body processes like menstruation. If you have low testosterone, estrogen dominates and your body processes aren't well regulated. And when this happens, then you can develop things like irregular periods, breast tenderness, depression, mood changes, gallbladder issues, hint, hint, and even low libido. So everybody talks about this idea of estrogen dominance as if they have too many estrogens. And when you talk about estrogen dominance, what you're really talking about is a bunch of different scenarios. So yes, you may have an increase in body fat that is causing an increase in estradiol. You also may not be able to clear out your estrogens through your liver, which can be another issue. You also can have an issue clearing out your estrogens, but then actually causing them to be reabsorbed in the large intestine, which is even why a stool test can be very important. Or maybe you have normal estradiol levels, but you're so low in progesterone. And you know that usually when a woman is having a problem with her menstrual cycle and it's going too short, they're like, well, let's just try birth control. And what's interesting is it can get it back up to normal without any testing, without anything. It's just try this and see if it works. Now, the other thing too is you got to be really careful because other things can also cause breast tenderness. One of them can be in a deficiency of iodine. So if you're low in iodine, you can also develop some issues with some fibrotic breasts, and they can also become very tender as well. So it's not always just estradiol. So getting back to, hey, here's what your menstrual cycle should actually look like. When you look at your 28-day cycle, one of the things that you're going to notice is that progesterone is actually very low within the first about 11 to 12 days, and it will start to go up. You will also see that your dominant hormone within your first 2 weeks is going to be estradiol. And this is actually what is building up the endometrial lining. What's also with estradiol is that it's an anabolic hormone. So not only is it building up your uterine lining, it's also building up the breast tissue. It's also why you may see that the breasts get bigger, or maybe even the backside gets bigger during that time. And so after you release an egg, that egg, the corpus luteum, which is the shell of that egg, actually then causes the progesterone, and that's what increases in the second half of your menstrual cycle. And that's what's maintaining the endometrial lining, which means if you're taking an over-the-counter birth control, it's keeping your progesterone levels constantly elevated. And if it's constantly elevated, the body says, okay, well, I am always pregnant, which is why that you will never have the release of an egg, because you don't menstruate and don't release an egg when in fact you are pregnant. And when I see this, I'm just always amazed at how, we think that we can manipulate hormones and manipulate physiology and believe that there is no side effects from doing this. So the whole idea with any kind of birth control, it's just over the counter, makes it more accessible to many people who may not even know what progesterone even does, or even why they would be having problems with their menstrual cycle as well, or maybe unaware that you can't actually get pregnant on any day of the month. You really only have about a 4 to 5 day window. And the reason why is you can't fertilize anything without the egg. But yes, you can actually have sperm that can live a little while within the actual within the vaginal canal, and within the uterus. So it's not just you only have 1 day to do it. You can have a few days in order for that to happen. But people also don't understand that there's other methods that you can do if you're not interested in having children. So the idea is to elevate your levels of progesterone so that the body thinks it's pregnant and to stop ovulating. That's the whole idea about it. Now, Cleveland Clinic, going back to it, they said, what are the side effects of taking progestin? So a synthetic form of progesterone. Now, this isn't coming from me. This is coming from the medical experts, okay? So here's what happens. Some of the side effects: changes to your menstrual cycle, changes to your periods. That's what the intention is when it comes to being on a progestin-based birth control. It can also cause low blood sugar. Pay attention to that one, okay? It causes low blood pressure. Dr. Nate, how does that happen? Because it actually, progesterone will signal the pancreas to start releasing more insulin. I'm going to show you an interesting study in just a second. It can also cause high blood pressure, cause changes in your mood. It can cause headaches, and it cause bloating or weight gain and cramping or abdominal pain as well. And if that's happening, that's an immune system issue. I'm going to go over a study in regards to that. Now, some of the more rare but serious side effects of progestin include blood clots, heart attack, stroke, liver problems, and blurred vision, okay? These aren't considered side effects. These are effects. You can't say, oh, we didn't want that to happen, because it's an effect of manipulating your hormones. They just call it a side effect because that's the one that they don't want. They don't want that to be an effect. And so they list one effect of not having your menstrual cycle as a result. So you're going to see what's so interesting. And this is why, you say is that changes in your mood. I want you even to think about this, guys. When you talk about antidepressants and you talk about mental health, is it men or women who are having most of the mental health issues and changes in mood? And it is a majority of women. And the reason why is I actually think that there hasn't been that many doctors to actually just sit down and explain to a woman is that if you're having a menstrual cycle, you're going to feel different mentally 4 different times out of the year or out of the month. And a lot of times they think that they should be emotionally exactly the same, but you can have the potential to have 4 different moods depending on which week that you're in. And to actually understand that, yeah, that's actually okay, because hormones affect the brain. Just like testosterone affects a man's brain, testosterone can affect a woman's brain, and so does estradiol, progesterone. It affects the brain. So when you look at the couple of the ideas I went over about low blood sugar and also having some immune system issues, when you talk about bloating or weight gain or cramping or abdominal pain, these are things that are involving insulin and things that are involving the immune system as well. And here also kind of says, when I've said is that, during, week 3 of your menstrual cycle, that's not a time to try to lose weight. And I'll explain to you why. And so this comes from PubMed. This is an article all the way back from 1982, 41 years ago. And they already knew this at this time. And it says the metabolic effects of progesterone. So progesterone has an important effect on carbohydrate, lipid, and protein metabolism. This steroid, it's a steroid hormone, okay? So it's derived from LDL, from cholesterol, induces hyperinsulinemia. So it increases insulin. Kind of like some of those, all of these GLP-1 agonists that are out there, like Wegovy, Mounjaro, and what's Ozempic? So it increases insulin, okay, which is why you can have low blood sugar. Now, it also promotes glycogen storage in the liver, but paradoxically, it antagonizes the effect on insulin on glucose metabolism in adipose tissue and in skeletal muscle. Okay, so I want you to think about that, because progesterone stimulates, because of that, the deposition of body fat, but has catabolic effects on protein metabolism. So if you think about that right there, when you look at week 3 of your menstrual cycle, that's when the body is actually preparing for pregnancy. And so at that point, it's actually what wants you to store fat. It doesn't want you to put on muscle, but it wants to store fat. And this is why during week 3 of your menstrual cycle, innately you'll have more hunger, and you will increase your calories to get ready for pregnancy. Okay. So when the steroid actions are considered together, their most relevant expression appears to be the physiological changes observed during normal pregnancy. So we actually think that the body is doing something wrong, but the body is doing something that's absolutely right. Now, what happens then if you are constantly having these elevations of progesterone, like you would be in week 3 of your menstrual cycle? Well, you're going to have lower blood sugar, you're going to have increased hunger, you're going to have weight gain, and you're going to have an increase in fat deposition. Don't think that I told you. All right. So you can't tell me that I didn't warn you. All right. So what happens, guys, is increased fat deposition, decreased muscle mass in order to support the pregnancy that your body is not going to have. And so it's cool and it's needed if it's, in 1 week, but this is going to be as long as you are on any kind of progestin-based birth control. Here's another thing. What about progestin and progesterone on the immune system? This is an article coming from about 23 years ago. Here's what's interesting. Elevated progesterone concentrations in the blood result in a more severe course and longer persistence of bacteria in infectious diseases and a decrease in the clearance of antibody-coated erythrocytes or red blood cells. Progesterone, now listen, progesterone suppresses specific components of the immune system, and it also suppresses natural killer cells, and it suppresses their activity while it's trying to mainly have a positive influence on other non-specific components. So is there an immune factor with elevations of progesterone? The answer is yes. It actually lowers down the immune system response. That's not a mistake that the body is making. And I want you to think about it, because as soon as the sperm and an egg come together and then implant within the endometrial lining, immediately what happens is that you have 50% of the DNA inside of you that is not yours. And it would make sense that the body suppresses the immune system, especially natural killer cells, so that the natural killer cells don't go after the egg and destroy it, because it does contain DNA that isn't yours. 50% of it actually is. So progesterone takes part in avoiding immunologic aggression of the maternal organism against the semi-allogenic conceptus or the fetus by suppressing specific components of the immune system and of natural killer activity. This is also why, if you don't have any kind of natural killer cell suppression, this can also be a reason why that there is a miscarriage taking place. Usually it will happen before you go from the first trimester into the second trimester. So progesterone suppresses the immune system to protect certain immune cells, like natural killer cells, from attacking the implanted fetus. Now, let me ask you a question at this point, because hopefully maybe the gears are turning just a little bit. So think of this. If high progesterone suppresses the immune system response, like in birth control, but also during pregnancy as well, why do you think the medical establishment wants pregnant women to get all of those shots? You ever thought about that? Why did they say it's so important for pregnant women to get the COV, et cetera, a shot? Why is it important to get the flu shot? Or why is it important to get all of these other ones as well? Well, they know that you are immunocompromised without taking into consideration that maybe, just maybe, it's having an effect on the fetus. Now, here's another question too, because a lot of women, when they have autoimmunity, many times they will say this: wow, here I have rheumatoid arthritis, I have scleroderma, I have lupus, but when I got pregnant, I've never, ever felt better. And why is that? Because high progesterone suppresses the immune system response. And so if you have a high inflammatory state, progesterone is actually going to bring that down as well. So why do you think women with autoimmunity feel better during pregnancy? And it has to do with the immunosuppressant response of progesterone. And here's another interesting article too. Progesterone-based compounds excuse me, affect immune responses and susceptibility to infections at diverse mucosal sites. So I want you to think of that, at diverse mucosal sites. So when you talk about your mucous membranes, which is separating internal to external environment, that's where infection actually takes place. So here's what they say: infections of the respiratory tract. Now, this comes from about 5 years ago, 6 years ago, give or take. And it says, to date, this is what just absolutely blows me out of the water, because listen to this. To date, few studies have assessed the role of progesterone-based compounds on infectious disease in the respiratory tract. Okay. So they're not even measuring the effect of the immune system on trying to elevate progesterone, whether it's birth control or whether it's hormone replacement therapy, things like that. They're not even studying what happens. There's been very few studies in regards to that. But trust us, it's safe and effective because we just want it to be. So they say this. So some of these progesterone-based birth control or hormones, it actually, they say this, it alters the outcome of Mycobacterium tuberculosis infection in mice by inducing an anti-inflammatory environment, including reduced production of tissue necrosis factor alpha, gamma, which contributes greater bacterial burden. It's lowering the immune response, leading to a greater bacterial burden. Treatment with any kind of progesterone also reduces virus-specific antibody titers, as well as virus-specific memory CD8 T cell numbers, which result in worse outcome following secondary influenza A virus challenge in female mice. Now, they did this in mice. Although the anti-inflammatory effects of progesterone-based compounds protect against a primary viral infection, the reduction in memory T cells, which I've done a lot of lives when it comes to your CD8 response and the response to a viral infection, it increases susceptibility to secondary influenza viruses. So it's increasing your chances of having secondary infections due to a virus. Now, the effect of progestins on the genital tract. So when you look at the immune system and you look at your body, your immune system wants to handle the battle at the barriers. So this is why, where does most of your immune system sit? Most of your immune system sits at the barrier. It sits at the castle wall. Why? Because it wants to handle any kind of attack at the castle wall before it gets inside and becomes systemic. That's why most of your white blood cells, they're not in your blood. Your white blood cells are sitting around underneath the skin, at the lung barrier, genitourinary barrier, gastrointestinal barrier. That's where it is sitting. That's where infection is supposed to take place. It's why you don't bypass the barrier in order to try to stimulate some kind of immune system response, because it goes against physiology. But here's what's interesting. Studies show that when compared with males, females have higher rates of sexually transmitted diseases, including HIV, herpes, gonorrhea, and chlamydia. Different stages of the menstrual cycle, along with the use of hormonal contraceptives, have been shown in both human and animal models to increase susceptibility to sexually transmitted infections. Many reasons have been proposed for the detrimental effects of progestins on sexually transmitted infections, including the altered thickness of the vaginal epithelium or the vaginal lining, increased expression of virus entry co-receptors, and induction of an anti-inflammatory cytokine milieu lacking essential antimicrobial pro-inflammatory cytokines such as interferon alpha, interferon gamma, interferon. What they're talking about is they're talking about chemicals released from the immune system. So what's interesting is even you'll see a change in the immune system with keeping progesterone levels at a high amount, not only preventing you from having a normal menstrual cycle, but it also suppresses certain immune system responses, which makes it more likely that you're going to have some kind of viral infection, especially at the respiratory barrier of the lungs, but then also increased risk of having a sexually transmitted disease because of the increase in thickness and mucus of the vaginal lining, and also a decrease in the immune system response. How unbelievable is that? Okay. Now, if you guys look at the sex hormone pathway or your steroid hormone pathway. This is specifically for people who might be taking a birth control pill to regulate or to normalize their menstrual cycle. They may say, oh, my menstrual cycle is going really, really short. I'm at like 21 or 22 days. And one of the reasons why is if you are converting, and if you look at this chart here, you are converting a progesterone. Instead of making progesterone, it's that pregnenolone is getting converted into cortisol, into a stress hormone. Then what happens is that you don't have enough progesterone, you can't maintain the endometrial lining, and your endometrial lining will shed early, and it'll also you probably will have a lighter period as a result. So stress, guys, plays a huge role in your menstrual cycle. So if you have a tremendous amount of stress, this is why we say stress devastates a woman's hormones, because a man's testosterone is not dependent on stress levels. Very little it depends on stress levels, but for a woman, it plays a huge, huge, huge role. So if you are low in progesterone and they give you a birth control that contains progesterone, they may be adding hormones in that what you think would be normal, but in reality, all they've done is added hormone, covered up the real problem why it was happening so that you continue to have a normal cycle, think you're okay. But in reality, you're sick if you're not having a normal cycle that's running 26, 27, 28, 29 days, or right around there. Now, here's what an interesting thing is too, because birth control, they're probably saying, hey, we want you to have over-the-counter birth control for conception purposes. But a lot of women are on a birth control pill to try to normalize and regulate their menstrual cycle. In fact, I had a woman come in who has suffered for the last 8 years of endometriosis. And in fact, it's so severe that literally just even laughing or bearing down in the abdomen produces a tremendous amount of pain. And in fact, as soon as her cycle starts on day one, tremendous abdominal pain. So much to the fact that she says, I can't even play with my son. I am in so much pain and I'm so absolutely miserable. And so even she has tried numerous like birth control. You name it, she's tried it with no kind of long-term relief coming from it. Well, here is actually an article from PubMed. It's about 2 years old. And it comes from the journal known as Reproductive Science. The title of it is this: Markers of Local and Systemic Estrogen Metabolism in Endometriosis. Now, stay with me. So what they actually saw is in women with endometriosis is they saw an increase in certain types of estradiol and estrogen metabolites. This is why when I say, hey, what is estrogen? They say it's a female hormone. No, it's not. It describes all the family of estrogens, which primarily is estriol, estradiol, and estrone, and then their metabolites of 2-hydroxy, 4-hydroxy, and 2 and 4-methoxy. So it's also describing its metabolites. So when you look at even endometriosis, it's not a production issue, it's a metabolism issue. And one of the things that they found is they found in women with endometriosis is they find a significantly higher of what is known as 4-hydroxyestrone. And you're like, I've never heard of that, Dr. Nate. What on earth is 4-hydroxyestrone? You don't measure it in the blood, you measure it in the urine because that's looking at the metabolism of it within the liver. And is there a test that you can actually see how you're metabolizing your estrogens? The answer is yes, you can. So if you're watching on YouTube, you're on Rumble, or you're on Facebook, you'll be able to see this. But we can go in and measure via urinalysis to see how you are converting and how you are metabolizing your estrogens. You can actually convert them down a very safe and preferred pathway to be able to get metabolized and methylated and removed from the liver to the gallbladder, into the gastrointestinal system, or from liver to kidney. But if you are metabolizing them down the 4-hydroxy pathway in a high ratio, then this type of estrogen metabolite has the ability to cause problems, specifically DNA damage. And if that is not repaired, then the problem is that it can bind and it can damage DNA, and it can cause abnormal growth and cancer cell proliferation. Why do you think women have hormone issues, whether it's endometriosis, PCOS, why they're having other issues later on with their fertility, not only with their fertility cycle, but with menopause issues and also with breast cancer, uterine cancer, cervical cancer, or anything that has estrogen receptors on it as well. And you can absolutely test this. So here's my question. Have you had your hormone production and also your hormone metabolism checked? And if a doctor decided to put you on birth control, especially if you are having problems with your menstrual cycle, number one, were they ever measured in production and in how they're getting metabolized before? And did they measure it after they decided to put you on some form of birth control? Now, the reason why I say, guys, this is a cautionary tale, because look at what has happened with hormone-based cancers over the last 40 to 50 years. And in fact, if you look at from 1975 all the way up to 2008, and I would argue that it's gotten worse even since 2008, that when you compare it to Sweden, Norway, Denmark, and the United States, both for African American and for Caucasian women, are way above everyone else when it comes to the incidence of hormone-based cancers. From 1975, you see it going up to 2008, and you've actually seen it go down a little bit. And one of the biggest contributors to that is that doctors stop recommending to go on hormone replacement therapies such as Premarin in order to prevent menopausal type symptoms, and also to prevent, they even put women on it for osteoporosis. So in reality, what they were doing is they were giving pregnant mare urine to women, never testing the hormones to see what pathways they would be going down. And they actually did cause a lot of hormonal based cancers. And they quietly said, hey, we're not going to do that anymore. Just like the dental field stopped doing mercury fillings and said the white ones are just look better, and that's why we're going to do it. Okay. So you'll see when they quietly get rid of something, it's because it was actually harming. And my question is why didn't you know that it was harming before? Why did you only know that it's harming until people had to suffer and people had to die? The other thing is too, is when you see an increase in hormone-based cancers, and not only that, when you look at the number of couples who have to do in vitro fertilization, this is actually looking at the market from Grandview Research, and they look at from 2020, and then they extrapolate it out to 2030. You're basically going to see the in vitro fertilization market double from $3.1 billion to over $6 billion every single year. So the reality is that people are having a hard time getting pregnant. And why are they having a hard time getting pregnant? Well, maybe is because we've manipulated the hormones with birth control. Maybe we have also have issues with high amounts of stress that's affecting our fertility cycle. Maybe we're subjected to a high amount of toxins that is causing problems with hormone metabolism. Maybe we have a problem with obesity as well that's causing issues with hormone metabolism, or causing estrogen dominance that's causing hormone issues. And so whenever anyone says, yeah, but it's just, it's rare. Take all of those different things, guys, take all of them. And now you wonder why there's so many hormone issues, why so many people are on birth control just to normalize their hormones. But then on top of that, we're taking birth control to prevent pregnancy. And then we're having problems when we decide we want to get pregnant. But then the answer is just to do in vitro fertilization. And it is amazing the number of people who unfortunately are going that route when they don't know that maybe there is a better way. We were biologically created and programmed to reproduce. And anybody who says it's genetic that I can't reproduce, I want you to think about that statement for just a second. So going back, I know that I said, hey, let's not make this some kind of like political argument, but sometimes when I see some of the statements that have been said, it does make me sad a little bit, because I don't think that they understand the health consequence of manipulating hormones for long periods of time. So when someone says, I'd rather be sick than pregnant, then the problem is I don't know that you truly understand what it means when you say to be sick. So you would be okay to have a hormone-based cancer. You would be okay to long-term suppress your immune system. You would be okay to manipulate your physiology and not do the biologically programmed thing to do to release an egg every single month. The amount of people who think that they know better, a lot of scientists and doctors who think they know better than the absolute wisdom of the body, you could see time and time again how that has been an abject failure when it comes to healthcare. So when someone says, I'd rather be sick than pregnant, it's like, do you truly understand some of the consequences and the ramifications of manipulating hormones for a long period of time? So hopefully, guys, you learn a little bit about progesterone, you learn a little bit about its function, and you learn a little bit about why I believe that birth control, for many reasons, can be a really, really bad idea. We're not trying to take away your rights. The first thing that I want to do is to not hurt you, but to actually help protect you and help you make great decisions that's going to leave you in a good position for your health, not only now, but down the road, especially. So guys, just one last thing. Remember, if you are from the Chicagoland area and you want to work with the Wellness Way Yorkville, myself, Dr. Brian, please make sure you get registered. August 10th is the next time that we'll be taking on new patients for our inflammation talk. And guys, when you understand that, it will make so much sense on what you need to do, where you need to start at when it comes to not only things in regard to your hormones, but your gastrointestinal system, when it comes to your digestive system, when it comes to your mental stress levels. Guys, we always say this, it's inflammation. It's like whatever you have as far as a diagnosis, stop looking at it as a disease and start looking at it as an injury. And so if you understand it's an injury, the next thing you're going to say is what am I doing to injure myself? Because how the body is created is to heal. If you have a scab on your knee, it's going to heal, but it won't heal if you keep falling on it. It won't heal if you keep picking at it. It won't heal if you keep interfering with it. And if you came to me with a scab that was unhealed after 1 year, the first thing that I would say is what are you doing to prevent it from healing? We wouldn't give you some kind of fancy diagnosis as chronic scabitis, so that you would feel good about that diagnosis. We're going to say, what are you doing to continue to create injury? And if we can remove the injury, support the body, then the natural progression of the body is to start to heal on its own. And I just came out of a consult about an hour ago with a young man who has suffered from 12 years of age with terrible, terrible eczema. He's had eczema all over his body, all over his arms, all over his torso, all over his legs. And at 8 weeks, it's about 2/3 of the way gone. He says, I can't believe this. This is absolutely amazing. I've been tried anything and nothing has worked, yet my skin is actually healing. And you know what he said? He said, I know that what you've told me to do is kind of hard. It can be hard for some people, but man, when I see myself getting better, that inspires me to keep going. And there's so many people that say, that's too hard, that's too difficult. Not for this person, not when you've suffered as much as he has over the last 25 years of having a chronic condition in which he can't bear his arms, can't bear his legs, and doesn't want to go swimming, things like that. Think about how his life is getting better and how it will continue to get better because he's going to continue to do the things necessary in order to bring health. And so if you are also from the contiguous 48 states and you want to work with us remotely, please make sure that you register for the inflammation webinar. We have it set for every Tuesday, 6 to 7, I believe, right around there, Central Standard Time, or you can watch it on demand. Make sure you watch it all the way to the end, because at the end, you will receive the link to be able to go and schedule a call with me. And then we can go from there and we can order the right tests and try to get a better understanding of what's going on with you. And just remember, as well, guys, just put this on your calendar. We will release the how to register for this coming up on Eventbrite very quickly within the next week to 2 weeks. The I Disagree seminar with Dr. Patrick Flynn, Tuesday, October 24th, 6 o'clock to 9 o'clock p.m. It is on a Tuesday night, but guys, I promise you this, it will be so well worth it. You will be absolutely inspired. It will change your life. I do mean that from the bottom of my heart because this is something that changed my life as well. So guys, what do you think? Let me know your thoughts over-the-counter birth control. Are you for it? Are you against it? If you're for it, let me know why. If you're against it, let me know why too. Just keep the debate respectable. All right. So guys, I hope you have a great rest of your night. I am entering into day 2 of fasting now. So probably tomorrow night, I probably won't be going live because I'll probably be suffering a little bit of hunger and a little bit maybe of brain fog as well. So guys, I hope you're well. I hope you stay well. I hope you have an awesome rest of your week and be blessed. And as always, remember who you are.